Good evening and welcome to this presentation on evaluating global health issues of HIV/AIDS in Nigeria. My name is onwe-nwoye. The objectives of this presentation is to show evidence and statistics that support the significant health, the HIV/AIDS and its disability adjusted life years in measures of mortality and morbidity. Discuss risk factor related to HIV/AIDS. Discuss potential gaps or limitation in data. List social or economic opportunities to control or reduce the prevalence of HIV/AIDS and discuss other points of interest. The evidence and statistics of HIV/AIDS in Nigeria. HIV/AIDS and in the globe too. HIV/AIDS is the fourth leading cause of mortality in the world. It is estimated that 36.7 million persons are living with HIV/AIDS, and about 1/3 of this population between the ages of 15 and 24 years. In Nigeria, it is estimated that 1.9 million people are living with HIV/AIDS, and in every 100 pregnant women, 7 of them are likely to have HIV/AIDS. The risk factors to HIV and AIDS. Cultural factors. Tradition and beliefs on other practices affect the understanding of health and disease acceptance and limit people from seeking treatment. Some other cultural barrier create barrier for women to seek treatment, to take precaution towards sex. Poverty, lack of information needed to understand and prevent HIV. Poor nutritional status, people commercializing sex for income and reduced access to healthcare services. Gender inequalities. In many cultures in Nigeria, men are expected to have many sexual relationships, and women suffer gender inequalities, often in economic in nature. And women may not feel empowered to negotiate whether sex happens at all or if they could use that protection. Drug use and alcohol consumption. During alcohol intoxication, individual is impaired in her judgment, and people that do drugs share needles and other equipment. Potential gaps and limitation to data. The patient living with HIV/AIDS, some of them are in denial and do not seek treatment. Data from rural areas are not reported appropriately. There's lack of adequate power supply to process and store data electronically. And there's a low data coverage, sometimes due to lack of personnel. Social economic opportunities to control HIV/AIDS will be, first of all, behavior change, use of protection during sexual activities, seeking treatment and care, and children with infection and the maternal mortality. Making a male circumcision more sterile so that people cannot be contact the disease, and targeting key areas. Some myths that needs to be disregarded regarding HIV/AIDS is that HIV/AIDS are not transmitted by insect bites, toilet seats, kissing, sharing cutleries, or by touching. Points of interest regarding HIV/AIDS. Young people are more significant at risk of contacting HIV/AIDS. Women are more affected than men in Nigeria. The LGBT community are at higher prevalence and illicit drug use. These are my references. Thanks for listening. Bye.